Medical Tactile Incorporated presents a clinical training video for the SureTouch system narrated by Dr. Carrie Kaufman. The use of these videos is strictly for demonstration of and the clinical training on the SureTouch visual mapping system by Medical Tactile Incorporated. The use or reproduction of these videos for any other purpose is expressly prohibited without the approval of Medical Tactile. Patient number 6 is a younger female patient with breast implants. The patient is undergoing a focused examination of her left breast. The patient thought she felt a palpable mass in the left upper outer quadrant in approximate area of the number 1 marker. It's important to realize that implants create a firm surface over which to scan with just a thin layer of breast tissue on top, and many times that tissue is fibroglandular. So a good analogy that Dr. Kaufman uses is it feels like several grains of salt spread over a table, and that's the sense of how the tissue feels over the implant. Now let's listen to Dr. Kaufman as he goes through this examination.
This patient thought she felt a lump over here in the left breast at about 2 o'clock. And the normal area was at was number 2 here, around 6 o'clock. And so this patient has bilateral breast implants, and she had 2 exams at number 1 area and 2 exams at number 2 area. But I'm going to start at the normal tissue first. It's very important to see what does a SureTouch examination of a breast implant looks like in comparison to a normal exam. We've seen in normal exams that it looks like waves of normal tissue as we pass over normal tissue, that looks like small waves running by, and the waves kind of come and go. In this particular case, because the implant is a firm surface, the waves seem to be almost stationary. Now this is 2.1 over here, and we're going to be looking at this area. And just let's take a look at this as it goes. We have the SureTouch transducer sitting on top of the portion of the breast, and we slide around that portion of the breast, and we note that the breast glandular tissue, which is very little glandular tissue, there's a very thin amount of breast glandular tissue, but that thin amount of breast glandular tissue is very identifiable. Each little small cluster of glandular tissue, the small ones and the little bit bigger ones, and the little bit bigger ones, and the small ones and the little bit bigger ones, each spot of glandular tissue is very identifiable. It is not accurate to look at any glandular tissue on the very edge of the transducer, like over there. But in the middle of the transducer, when the transducer covers the entire glandular element, it's accurate to determine. And notice how they all move at the same rate, and they're all visible all the time. That's typical of what an implant might show. A very thin area of breast tissue, and you place the transducer over it, and you continue to visualize all these areas of glandular breast tissue. This is a benign, non-cancer area examination of normal breast glandular tissue overlying an implant. And then to be sure that we're not missing something, we look at it again. And so we'll take a second picture, number 2, of that area. And actually the still picture looks like there's a small nodule here, another small nodule there, a bigger nodule here, and maybe something there. But let's watch as it comes along. Here, these paired nodules here, that was just that little peak that occurs there. The examiner's hand is pushing on that little nodule a little bit harder and creating the peak. But in reality, you can see that that nodule is no different than the first nodule right below it. These 2 paired nodules, and maybe even this one down here, are all very similar. And that's what typical glandular tissue, a thin rim of glandular tissue overlying a firm breast implant, will look like. Well, if these 2 exams here of number 2, if that's what normal glandular tissue looks like on top of an implant, what about number 1? Now this is an area that we're examining, and there's a little pop of a mass that looks like it pops up there, but we're not looking at the rest of the glandular tissue, so we have to give it a chance. We look in this area, and there seems to be a dominant mass, a dominant nodule that, as we center it in our transducer, it continues to be visualized. There's another little area of glandular tissue down here, here, and there. Again, moving as breast implant breast tissue over an implant moves, but this particular center area seems to be fairly dominant. On the other hand, our exam force was fairly light. In fact, it was too light. For exam force is less than 0.5 kilograms will not show up on the accumulated image even if there was an abnormality there. So our results showed 0 by 0 by 0 millimeters as far as a mass, essentially no mass, no peaks. On the other hand, if we examine it again and we happen to use slightly more force, then what we see is we can make that little segment of nodule more prominent, and if our force is above 0.5 kilograms, then we will get an accumulated image. And here we see a nodule that is persistent, is smooth, is not very hard relative to the surrounding tissue, but is dominant in this area. Now we have to remember that this is a very thin amount of breast glandular tissue overlying the implant. And to see a nodule like this, even if it measures 12 by 12 by 12 by 12, and it's 5 hardness, it's 5 hardness relative to the surrounding tissue. And so it's not very difficult for even a dense area of glandular tissue to become a 5 hardness with an implant in place. And that's where the history comes into play. It's very important for the for the examiner to know that there's a breast implant here, because this in normal breast tissue would not be so dominant. If there was a significant amount of normal breast tissue behind this nodule, then it would not be that hard. But we don't. We have essentially, it's a nodule sitting on a hard surface, and it accentuates and exaggerates the relative difference between the firmness of this particular nodule and the firmness of the normal glandular tissue. So it shows up as a nodule that's measurable in the left breast at 2 o'clock, that has a hardness of 5, and it's a single peak. And basically we have to say this is an area of a single nodule in that portion of the breast, which may be a mass. It turns out that this particular patient had an area of dense glandular tissue as the explanation of this, but because this patient had hardly any breast tissue, as is shown on these previous exams at 6 o'clock, she has any breast tissue tends to show up as a small nodule. A dominant nodule at 2 o'clock shows up in this way.
Medical Tactile would like to extend our sincere appreciation to Dr. Carrie Kaufman, the medical director at Bellingham Breast Center in Bellingham, Washington, for his time and participation in this video. You can find out more information about the SureTouch visual mapping system and Medical Tactile Incorporated at our website at www.medicaltactile.com. Thank you.